Hi everybody, this video of mine is about shingles, which is a viral infection that causes a painful rash. Although shingles can occur anywhere on your body, it most often appears as a single stripe of blisters that wraps around either the left or the right side of your torso. Shingles is caused by the varicella zoster virus, the same virus that causes chickenpox. Yesterday I made a video on chickenpox, you can see it, and that same virus is responsible for shingles. After you have had chickenpox, the virus lies inactive in nerve tissues near your spinal cord and brain. Years later, the virus may reactivate as shingles. While it is not a life-threatening condition, shingles can be very painful. Vaccines can help reduce the risk of shingles, while early treatment can help shorten a shingles infection and lessen the chance of complications. Now I'll tell you the symptoms. The signs and symptoms of shingles usually affect only a small section of one side of your body, as you can see in the images. These signs and symptoms may include pain, burning, numbness or tingling, sensitivity to touch, a red rash that begins a few days after the pain, fluid-filled blisters that break open and crust over, itching. Some people also experience fever, headache, sensitivity to light, and fatigue. Pain is usually the first symptom of shingles. For some, it can be intense. Depending on the location of the pain, it can sometimes be mistaken for a symptom of problems affecting the heart, lungs, or kidneys. Some people experience shingle pain without ever developing the rash, so this thing you should keep in mind. Most commonly, the shingle rash develops as a stripe of blisters that wraps around either the left or right side of your torso. Sometimes the shingles rash occurs around one eye or on one side of the neck or face. You should contact your doctor promptly if you suspect shingles, but especially in the following situation, which I am going to tell you now. If the pain and rash occurs near an eye, if left untreated, this infection can lead to permanent eye damage. If you are 60 or older, because age significantly increases your risk of complications. If you are someone in your family has a weakened immune system due to cancer, medication, or due to some chronic illness, if the rash is widespread and painful, in these situations you should contact your doctor immediately. Now let me tell you the causes. Shingles is caused by varicella zoster virus, the same virus that causes chickenpox. Yesterday I made a video on chickenpox. You can see that video. Anyone who has had chickenpox may develop shingles. After you recover from chickenpox, the virus can enter your nervous system and lie dormant for years. Eventually, it may reactivate and travel along nerve pathways to your skin, producing shingles. But not everyone who had chickenpox will develop shingles. It's not necessary that if you suffer from chickenpox in the childhood, you will likely suffer from shingles. So this thing you should keep in mind. You can suffer from shingles later in life, but it is not necessary. The reason for shingles is unclear, but it may be due to lowered immunity to infections as you grow older. Shingles is more common in older adults and in people who have weakened immune systems. Varicella zoster is part of a group of viruses called herpes viruses, which include the viruses that cause cold sores and genital herpes. Because of this, the shingle is also known as herpes zoster. But the virus that causes chickenpox and shingle is not the same virus responsible for cold sore or genital herpes, which is a sexually transmitted infection. A person with shingles can pass the varicella zoster virus to anyone who is not immune to chickenpox. This usually occurs through direct contact with open sores of the shingle rash. Once infected, the person will develop chickenpox, however, not shingles. Chickenpox can be dangerous for some people until your shingles blisters scab over. You are contagious and you should avoid physical contact with anyone who has not yet had chickenpox or the chickenpox vaccine, especially people with weakened immune system, pregnant women and newborns. Now let me tell you the risk factors. Anyone who has ever had chickenpox can develop shingles. Most adults in the United States had chickenpox when they were children before the advent of routine childhood vaccination that now protects against chickenpox. Factors that may increase your risk of developing shingles include being older than 50. Shingles is most common in people older than 50. The risk increases with age. Some experts estimate that half the people aged 80 and older will have shingles. Having certain diseases such as HIV/AIDS and cancer, which weaken your immune system, can increase your risk of shingles. If you are undergoing cancer treatment, then radiation or chemotherapy can lower your resistance to diseases and may trigger shingles. Also, there are certain medications, for example, drugs designed to prevent rejection of transplanted organs can increase your risk of shingles, as can prolonged use of steroids such as prednisolone. Complication. These complications include post-herpetic neuralgia, which is a very painful condition. For some people, shingles pain continues long after the blisters have cleared. This condition is known as post-herpetic neuralgia, and it occurs when damaged nerve fibers send confused and exaggerated messages of pain from your skin to your brain. Also, there could be vision loss. Shingles in or around an eye, that is ophthalmic shingles, can cause painful eye infection and that may result in vision loss. Neurological problems. Depending upon which nerves are affected, shingles can cause an inflammation of the brain, which is known as encephalitis. It can also cause facial paralysis or hearing or balance problems. Skin infection. If shingles blisters are not properly treated, bacterial skin infection may develop. Coming to the prevention, two vaccines may help prevent shingles: the chickenpox varicella vaccine and the shingles varicella zoster vaccine. Chickenpox vaccine. The varicella vaccine has become a routine childhood immunization to prevent chickenpox. The vaccine is also recommended for adults who have never had chickenpox. Though the vaccine does not guarantee you won't get chickenpox or shingles, it can reduce your chance of complication and reduce the severity of the disease. Coming to the shingle vaccine, people looking to receive the shingle vaccine have two options: Zostavax and Shingrix. Zostavax, which was approved by FDA in 2006, has been shown to offer protection against shingles for about 5 years. It's a live vaccine given as a single injection, usually in upper arm. Shingrix was approved by the FDA in 2017 and it is the preferred alternative to Zostavax. Studies suggest that Shingrix offers protection against shingles beyond 5 years. It is a non-living vaccine made of a virus component and it is given in 2 doses with 2 to 6 months between the doses. There is an interval of 2 to 6 months between the 2 doses of Shingrix vaccine. This is approved and recommended for people aged 50 and older, including those who have previously received Zostavax. Zostavax is not recommended until age 60. The most common side effects of either shingle vaccine are redness, pain, tenderness, swelling and itching at the injection site, and headaches. I will personally recommend Shingrix vaccine, which is a better option. As with the chickenpox vaccine, the shingles vaccine does not guarantee you won't get shingles, but this vaccine will likely reduce the course and severity of the disease and reduce your risk of post-herpetic neuralgia. The shingle vaccine is used only as a prevention strategy. It is not intended to treat people who currently have the disease. You should talk to your doctor about which option is right for you. Now coming to the diagnosis of shingles. Shingles is usually diagnosed based on the history of pain on one side of your body, along with the telltale rash and blister. I have seen so many patients of shingles, and it's very, very easy to diagnose just by looking at the rash and the typical symptoms of pain. Your doctor may also take a tissue scraping or culture of the blister for examination in the laboratory. Coming to the treatment, there is no cure for shingles, but prompt treatment with prescription antiviral drugs can speed healing and reduce your risk of complication. These medications include acyclovir, which comes with the name of Zovirex, and another medicine, valacyclovir, which comes with the name of Bortrex. Shingles can cause severe pain, so your doctor also may prescribe capsaicin topical patch which comes with the name of Quintenza. As doctor may also prescribe anticonvulsants such as gabapentin, Neurontin. This may also relieve pain. Also, you can be given tricyclic antidepressants such as amitriptyline. These all treatment which I am telling you are for the treatment of pain in shingle. Also, you can have the option of numbing agents such as lidocaine, which is delivered via cream, gel, spray, or skin patch. Also, there are medications that contain narcotics such as codeine can be given. An injection including corticosteroid and local anesthetics can be also given for pain relief. Shingle generally lasts between 2 and 6 weeks. Most people get shingles only once, but it is possible to get it 2 or more times. Here are some lifestyle and home remedies. Taking a cool bath or using cool wet compresses on your blister may help relieve the itching and pain, and if possible try to reduce the amount of stress in your life.